Hello, Dr. Pranaya here. Today we are going to discuss few common frequently asked questions by patients regarding hair transplant. Because there are a list of things to avoid after hair transplant surgery, so they ask, why do you ask to avoid gym, exercise, and not to use a helmet or t-shirts, and do not wax or scalp. So you have to understand that after hair transplant surgery we advise for 2 months not to involve in any vigorous activity, because if you sweat a lot, the scalp will get wet enough with the sweat. It has tendency for fungal growth on that area, that is damaging the scalp as well as the hair which are about to grow. That's why we advise you not to go for gym activities, swimming, or any such activity which will give you a lot of sweating. We ask you to avoid helmet and any occlusions onto the scalp like cap or anything, because that will act as an occlusion and again it will damage the hair, it will hamper the growth. You are not supposed to use hair color, hair wax, or any cosmetics on the scalp. Avoid damage onto the scalp and the hair. So certain things post surgery we advised so that the enrooting of the grafts happen well without any damage. Then head wash. We advise you to wash your scalp. The first wash is always after 7 days. So head wash related queries are very common. After how many days to wash? Some people say after 3 days, some people say after 5 days, 7 days, 10 days, 12 days. So it depends. Also, if you have a tendency for an oily sticky scalp, it's better to go for head wash after 5 days of the surgery. If yours is a very troubling scalp in a way that you are not able to manage, it's very itchy, you are getting a lot of pimples and the crusts are too heavy that you are not able to clean it that well, then you can immediately after 3 or 4 days also you can do the head wash. You have to understand that head wash should not be vigorously done. It should not damage the hair follicles. You only have to clean the crust that are formed onto your scalp. Actually, you should come down to the clinic wherever you have done a surgery, get your head wash done, get dry, and let the doctor see it if you have anything that is to be taken care, and accordingly next few weeks what all solutions or what all shampoos you have to use, the doctor can advise you. So that was about the head wash. Age related factor during hair transplant, that's a very common question. Hair transplant can be done in any male who is 25 age. If you have actual bald area, you can undergo hair transplant up to 55. Why not after 55? If you are healthy enough, if you have good donor area and there is no thinning, if your health condition is stable enough and you have enough scalp hair, then definitely you can go for the transplantation. Survival of the hair follicle after the surgery, that is the common question. After the harvesting of the grafts is done, we keep the grafts under certain temperature and under certain solution that keeps the graft survival for a longer time, that's 6 to 8 hours. So after the harvesting or the extraction of the graft is done, you have to implant it within 6 to 8 hours. Survival is determined by how fast you extract and how fast you implant. So the lesser the time of the graft outside the body, the better is the survival. So 6 to 8 hours anyways, any hair transplant surgery is done. Longer hours are avoided. And we always maintain the temperature by using ice packs and ice cubes, and we keep spreading ringer lactate or normal saline solution onto the graft to make them survive in a better way. Sometimes we are getting lot of issues after taking anesthesia. In a way, it's very painful. That is a common question. So whenever we give nerve block, it's not much painful because few early injections only are painful. After that you do not understand the prick, so the procedure goes very smooth. Sometimes when your scalp is very fibrotic, if you have scars, surgical scars, or even any accidental scars on the scalp, that area becomes hard. So at that time it's little more painful. If you have tendency for dry scalp or dandruff, at that time your scalp is inflamed. If it was not taken care enough before the surgery, then at that time the scalp has a tendency to bleed. Even it has a tendency for low absorption of the anesthesia, so it takes longer time. The fibrotic scalp and inflamed scalp take longer time. Next is if you have tendency for smoking and alcohol. So smoking and alcohol indirectly damages the circulation onto your scalp also. So when the circulation is damaged, definitely the area is inflamed and you cannot get a good quality of harvesting at that time. Maybe your hair follicles are normal, but the scalp may not be normal because the circulation and the skin quality will be hampered. Then the question is, after how many days of transplant can we shave the scalp or trim the scalp? Initially after the transplant is done, we do not advise you to trim or shave your scalp for first 3 to 4 months. Only after that you can do the trimming and shaving or cutting the hair. Why so? Because initially after the transplantation is done, hair goes under shedding time and then it starts growing at the end of 3 to 4 months. So at that very time, if you are not touching or damaging that area or causing trauma to that area, it's well appreciated, because the hair roots that are there inside should not get traumatized by the external pressure or external vibration. That is why we ask you not to undergo any cutting or trimming onto the scalp. Next is, if I have migraine and pain, can I undergo surgery at that time? Definitely your migraine has to be treated prior to the surgery, before undergoing a surgery. On the day of surgery, if you are getting a migraine attack, we can manage it well, that's not a problem, with some painkillers on NSAIDs. But after surgery, again you have to take enough rest, because surgery itself may act as a trigger for your migraine, because there are a variety of triggers for migraine. So when you are in a pain of migraine, it's better not to undergo a surgery immediately, let your migraine attack subside and then you can undergo the surgery. If I have high sugar, is there any complication with hair transplant? That is a question. Definitely diabetes is one of the high risk for any surgery. Hair transplant is also cosmetic surgery, so if you have uncontrolled diabetes, if your HbA1c level is more than 6.4, or you have blood sugar levels which are always keeping very high, fasting and postprandial also, it's better to take control of your diabetes first before undergoing hair transplantation. There is no contraindication to undergo surgery in diabetics, but your diabetes has to be under control, because long term, if you are long standing uncontrolled diabetes has a complication onto the hair, that it makes the hair very thin, as well as after surgery wound healing will be delayed. Your scalp donor area will take little more time for healing, as well as you have more chance of getting infections onto the scalp. That bacterial infections are very common, so you get a lot of redness or pus filled lesions onto scalp. Importantly, if you get those pus filled lesions onto the implanted area, the graft will not grow in a better way. So these are certain complications, and in due course of time, if your diabetes is not under control, overall thinning onto the scalp hair is possible, so that you have to count. Then the question is, during hair transplant surgery, how much blood loss is happening? The blood loss is very minimal. If you have a bleeding disorder or if you have a coagulopathy, at that time only blood loss is more. There is a very minimal blood loss during hair transplant surgery, which is uncountable actually. Next question is, for the hair growth, if I am taking protein powder or taking steroids, is there any side effect? Definitely, when you are taking steroids for bodybuilding or you are taking a lot of protein powder for bodybuilding, that is not having good effect on your hair, otherwise also. So we advise you not to go for certain protein powders or steroid injections when you are planning for a hair transplant surgery, because that will hamper the growth of the implanted hair. Then very common question is, if I have dandruff on my scalp, can I undergo hair transplantation? I just mentioned before, if you have anything on your scalp, any dandruff, dry scalp, pimples, oiliness, it has to be corrected before undergoing a surgery. So whenever you are planning a hair transplantation, better you have a consultation with your skin doctor and discuss the things, that I have such type of scalp condition which has to be treated prior. On the day of surgery, your donor area as well as your implantation area should be clean and without any inflammation or any pimples or infection. That is a healthy skin which will have good harvesting, as well as the healthy skin will have good implantation also. So better you get your dandruff or your seborrheic dermatitis treated before surgery. Next question is there any issues with weight gain after hair transplantation? There is absolutely no such thing related that you will gain weight after hair transplantation. It has we are not giving anything hormonal that you can put on weight. After surgery, we are only giving antibiotics and painkillers and some medication to apply onto your donor area to make it heal, and some saline spray to make your implanted hair grow. So that way there are no such complications of weight gain. Next question is, if I have high BP, is there any side effect during surgery? Definitely, high blood pressure will cause problem intraoperatively during surgery. If your blood pressure is very high, whatever anesthesia we are giving, your cardiac problems may rise. So at that time, BP control is very important. Prior to surgery, better you take a medical fitness from the physician. You are taking the medication for hypertension. Get it treated well. They will advise you certain change in your medication. Follow that medication for particular period of time before and after surgery. That is advisable. At the time of surgery, if any fluctuation happen between your blood pressure, either it goes high or low, we can manage intraoperatively with the help of anesthetist. So whatever dose of medication is needed, we can do very much at that time. But pre and post surgery, definitely you have to take care of the hypertension. It doesn't have direct effect on the hair growth, but definitely high blood pressure is relative contraindication for undergoing a surgery. So friends, these were all common questions related to hair fall and hair transplant surgery. We'll see you again. Keep watching the channel. Thank you so much.